Welcome, Amy. Thanks very much for coming in today. So what is it that we're seeing you for today?
Well, I'm interested in finding out a little bit of information about abdominoplasty.
Sure. So let me ask you a couple questions first, and these are sort of all involved with whether you'll be a good or bad candidate. Have you had any previous abdominal surgery?
I had my appendix out when I was about 19.
Okay. And have you had any children?
2 children.
2 children. And how were they born?
Vaginal births.
Okay, perfect. Reason I ask that is sometimes if you have a previous C-section incision, we'll use our incision through that and just extend it on the lateral aspects. Perfect. Are you a smoker?
No.
Good. The reason I ask that is that when we do a tummy tuck, a lot of the blood supply that goes through the skin is really critically affected by smoking, and you really are not able to have a tummy tuck if you've been smoking within at least the last 6 to 12 weeks. So all of our patients have to stop smoking for 6 to 12 weeks before surgery. Really is quite critical. Are you on any medications?
No.
And any allergies to medications?
Sulfa drugs.
Perfect. Okay. Good. And do you exercise?
I do, yes.
Perfect. It looks like it. And how is your weight? Are you close to your ideal body weight?
I'm probably about 10 pounds over what I usually am.
Okay. And does your weight fluctuate much at all?
Not really.
Good. Okay. And so what we'll do now is, what is it about your tummy that you're hoping to address that you think a tummy tuck will help you to achieve?
I just feel that I have a lot of loose skin from having the babies, and I also have stretch marks.
Okay.
And I just feel that no matter how much exercise I do, this area just doesn't ever seem to change.
Well, usually that's actually correct, because after you've had children, it's really an anatomic issue that happens. The first one is that the lower abdomen gets stretched out, so you have excess skin. And when you have excess skin, if that hasn't retracted after you've had your children, you really are not going to be able to get rid of that. So that little extra skin that you have that may hang over or looseness, that is excess skin, and that really has to be addressed surgically. Second thing is that if you have the stretch marks, if they came after the time of after your children, are they below or above your belly button?
They go right up to
about
about
the
my
belly button. So the nice thing with a tummy tuck is usually we're able to remove all of those stretch marks.
Excellent.
Also, sometimes with the children, you actually have some fullness on the upper abdomen, and that's from the separation of your six-pack muscles, the rectus muscles, and that gets separated when you have children. And again, that has to be put back into place anatomically. Okay.
Great.
So what we'll do now is I'll get you to change, or I'll just get you to stand up, and we'll take a look. That way I can examine you and tell you exactly what would work best for you.
Okay, great.
Okay, great. Okay, Amy, great. So what we're going to do now is if I can just get you to bring that down just a little bit, just to above the pubic area. Okay, perfect. So certainly, you look like you're going to be a great candidate. So all this skin here is just loose extra skin. And the stretch marks, again, very easily will be removed. This is very commonly seen after someone's had children. Very common in a fit person to have this loose skin. You've got no fat here, so it's just empty skin. And it's frustrating because no matter how hard you work out, you just can't get rid of that extra skin.
That's right.
And that's because once you have extra skin, you really can't tighten it. It has to be removed surgically. So what's involved is you'll have an incision that goes from over in front of the hip here, down through the suprapubic area here, and over to this hip. And then all of this skin to above the belly button, so all the areas that have your stretch mark are all going to be removed. So you're going to be really having a great result. You got great quality skin up here. There's very little fat at all. We'll be able to get you nice and flat. And then also you'll see the muscles here are just slightly separated, which normally happens with children. And we'll be able to tighten those up, and we tighten them all the way from the bone up here to the pubic bone down here. So that will give you a very good result. We maintain your normal belly button. We just bring it out through a small little incision when we bring all this nice natural skin down to the lower area here. We'll do a small amount of liposuction laterally. You don't really need much, but it just helps us with the closure and will give us a really good result. Okay, Amy, so now what we're going to do is I'm going to examine you on the examining bed, and we're going to see the state of the rectus muscle, of your muscles up top, to see if you have any separation. Okay, so let's go on over here. Okay, Amy, so what I'm going to do now is I'm just going to examine your upper abdomen, and what we're looking for there is a separation of the muscle. And that happens when you've had children. The two muscles normally sit side by side, but then they get separated with when you have children. And that's what gives you the increased diameter here. And what we do during a tummy tuck is we tighten the muscle back together, and that's what gives you your flatness, all the way from the muscle up here to the muscle down here. So what I'm going to do is I'm just going to feel in the midline. I'm going to have you do a half sit-up, if that's okay. Okay, you want to sit up halfway? That's good, perfect. Okay, and back on down. Good. So you have a little bit of a separation, and what you can feel is that one of your muscles is sitting over here, and the other muscle is sitting here. That when we do surgery, we'll bring those back together, and that will make that nice and tight, and that will really give us a good result. And as you can see when you're sitting down, we're going to be able to pull all this nice healthy tissue down into the lower abdomen here, and you're going to have a nice clean abdomen like that.
Great.
Okay, Amy, so what I'm going to do now is I'm going to step out. You can change back into your normal clothes. We'll come back, we'll answer any further questions you have, and then we'll go from there. Okay?
Okay, great. Thanks.
Perfect. Great, Amy. So do you have any further questions?
I do. I need to know, how many weeks would I have to take off work?
Sure. So generally what we do is it's usually about 1 week off of work. And what we want to do during that time is really take it nice and easy so that you start healing very nicely. Most people find that after 1 week they're able to go back to most activities. Usually I try to get people to stop exercising for at least 2 to 3 weeks. By 3 weeks you're back to most activities and sports that you want to be. But for the first week to 2 weeks we want to keep your blood pressure down. That really helps keeping you healing nicely and decreases any issues that we may have. We'll see you each week for the first month, and then probably every 2 weeks for the next month after that. Great, Amy. So what we're going to do now is the office staff, they're going to give you some more information that you can read at home. And if you have any further questions, you can either give us a call or reach us by email. Great. So thanks very much for coming in today.
That's fantastic. Thanks for all your time.
My pleasure.